Hello guys, today we will learn about flail chest. As all of you know that it is an emergency condition and results from the trauma. So usually the cause of injury is blunt trauma, which is associated with multiple rib fractures. So in this way, if the person hits his chest on the steering and if the rib is fractured, it may lead to flail chest. So by definition, some books say 2, some books say 3 or more ribs fractured at 2 or more places. So if you want to quote some book, quote Belly and Love and say 3 or more ribs. So because 27th edition says this. And the diagnosis is purely clinical. To confirm the diagnosis, the chest wall is observed for paradoxical respiration. So before moving forward, I want to show you what is the paradoxical respiration. So let us see one video for this. So if you can see, this is the flail segment and the flail chest, and this is moving in opposite direction of the rest of the rib cage. So let us move to the lecture now. Okay, so it can be a minor flail chest in which the segment is small and there is no ABG alteration. So this patient was, you can say, having a small segment flail chest, and the major flail chest is when the segment is large and there is ABG alteration. The usual association is, obviously you know by now, is significant blunt trauma, and the inspiration is paradoxical. This happens as you have seen in the video. One segment goes out and one, or you can say rest of the chest goes in. So in inspiration, less air moving in the lungs, so the loose segment of the chest wall displaces inward, and in expiration the segment moves outwards, that is, the respiration is paradoxical. The treatment is analgesics, ABG monitoring oxygen if required, chest physiotherapy, chest tube if there is pneumo or hydrothorax or effusion. So the chest tube is obviously not to be inserted to the flail segment. It should be either above or below it. Intubation and positive pressure ventilation may be required depending on the patient condition. So mechanical ventilation, traditionally mechanical ventilation was simply used to internally split the chest, but had a price in terms of intensive care unit, because obviously you have to monitor the patient should be in the ICU, and the ventilation dependent morbidity was also there. So current treatment is oxygen, opioids and physiotherapy. Opioids is not exactly opioids. The main thing is analgesia, which is required. So we mostly use opioids because usually patients do not respond to other painkillers if the trauma is significant. So ventilation is reserved for the cases developing respiratory failure despite adequate analgesia and oxygen. So voluntary splinting of chest wall occurs in flail chest, which is resulting from the pain. In this, mechanically impaired chest wall movement is there and associated lung contusion, which contribute to the hypoxia, and the risk of developing a pneumothorax or hemothorax is very high. If you talk about the gold standard investigation for the diagnosis of flail chest, I would say it is CT scan with contrast to display the vascular structure and a possible 3D reconstruction of the chest wall. If a chest tube is in situ, the topical intraocular local anesthetics or analgesia can be used via the chest tube. So it will help in pain relief maybe. Surgery to stabilize the flail segment using internal fixation can be done in selected group of patients with isolated or severe chest injury and pulmonary contusion. Thank you so much. If any questions, write in the comment box.